Good morning. My name is Gail Nakwa. I am going to moderate today's webinar. So I am the director in our Department of Health Services Tribal Affairs Office, and today we are hosting a budget briefing on our DHS budget initiatives. We are recording the session today, so whoever has registered, we will send out the link to this recording and the slides from today. You can use the question box if you have any questions during this session, and we will answer those as they come up. Our speakers today are Deb Sandridge, our department's Deputy Secretary. We have H.J. Waka, who is our Legislative Director. Jamie Kuhn is the Medicaid Director. Ginger Steele is our Division of Care and Treatment Services Administrator. And Paula Tran is our State Health Officer in the Division of Public Health. And so with that, we will start with Deb Standridge. Good morning, Deb.
Hi, everyone. Thank you for being here today. As Gail said, I'm Deb Standridge. I'm the Deputy Secretary for the Wisconsin Department of Health Services. Very excited that you're joining us today. Governor Evers' 2023 to 2025 breakthrough budget for DHS leverages Wisconsin's unprecedented surplus to make substantial investments in Wisconsin's healthcare, behavioral health, public health, and long-term care systems, as well as initiatives to advance equity and reduce disparities in our state. The governor's 2023 to 25 state budget includes multiple investments aimed at supporting tribal nations in Wisconsin and providing the needed resources to ensure Native communities can thrive in critical areas such as health and childcare, environmental justice and stewardship, education, and importantly, public safety. For our tribal leaders joining us today, we are so appreciative of your support to ensure this budget helps to support a healthier Wisconsin. Thank you for the tremendous amount of work you do every single day to protect and promote the safety and health of your communities. We need to ensure every Wisconsinite and every community has the supports provided in this budget that invests in our working families and drives economic growth. Good health is essential for everyone, and Governor Evers is dedicated to preserving and protecting the health of Wisconsinites throughout the entire state. Before we go into details of what's in the budget to support these initiatives, I'm going to turn things over to my esteemed colleague, H.J. Waka, our Legislative Director, to talk more about the budget process. H.J.?
Thank you, Deb, and appreciate that. And good morning, everybody. I'm Poso. Really appreciate you taking the time to join us today to talk about the budget, to talk about the budget process, and to hear more about the initiatives that are carried here in Governor Evers' 2023-2025 biennial budget. But before we get too far down the weeds and into the details of what is actually in the budget, wanted to start with a high-level overview of what is in the budget and kind of the process overall. So we'll give you that kind of overview of where we are. Next slide, please. For those of you who haven't heard this before or may have heard this in other areas, I'm very much a big believer that the budget process never really stops. The budget is always ongoing, and that can be reflected here on the slide before you. Is that, as soon as one budget is finished and signed into law, the next one begins. And so that starts with that little red arrow at the top of the circle and then moves forward from there. And so where we are today, more or less, is at that little yellow arrow at the bottom of that wheel of that cycle. We've already, state tribal agencies and tribal nations have a similar budget process to what you see at the state. But as far as Wisconsin is concerned and the state process is, we started accepting submissions after the most recent budget. The agencies submitted their budget to the Department of Administration in September of last year. DOA pulled all of those together to give to the governor. Governor put his budget forward back on February 15th. to send to the legislature, and then that kicked off the formal budget process and where we are at now. So as we are going through right now, like I said, we were at that little yellow arrow at the bottom of the circle. And that's where, you know, the legislators get a chance to review of it. Joint finance is getting a chance to review of it. That's where we start seeing a lot of the agency hearings, which have already happened a couple of weeks ago, as well as the beginning of the roadshow, where joint finance goes across the state to hear input from members of the public. And those that started kicked off last week, there's a couple more that'll be coming up here in the coming weeks. And if you have not had a chance to do so already, I would highly recommend that each and all of you go to those hearings, those roadshow briefings in person, to make sure that your voice is heard, that you're able to advocate for your needs and for the items and the initiatives that are in the governor's budget. But once that is done, joint finance will then take all that feedback back, and then they'll start having executive sessions on the budget. They'll then pass their formal version of the budget out of committee, where it'll then go to the floor for a vote on both the Assembly and the Senate, and then they'll be signed over to the governor's office. He'll do his line item reviews, his line item vetoes, and then sign it, and then the budget process will then repeat. But again, really want to emphasize there is still a critical time and a critical window for all of you to show up and to advocate for the initiatives in the budget and to make your voices heard. And next slide, please. And again, as I mentioned, the best place to do all that is at the joint finance hearings at the roadshow. So as you can see on the slide here, there's a couple coming up this week, some in Eau Claire, one in the Dells, and then there'll be one up in Minocqua on April 26th. So still plenty of time to get out there, still plenty of time to show up. Again, if you can have members of your communities or you yourselves show up and attend those, always a great opportunity and always worth it. It's never a waste of time to get up in front of the members of joint finance and make your voice heard. So if you haven't had a chance to do that yet, highly recommend it. Next slide, please. Now, regarding Governor Evers' budget, one of the big things that is contained within this is that health is a cornerstone of the state. It's a cornerstone of our workforce and economic development, and not just in all communities, but specifically Native communities across the state of Wisconsin. And Governor Evers' budget makes critical investments to support working families and address long-standing workforce needs to drive economic growth across the state. Next slide. Overall, DHS's budget comprises about $17 billion annually. That's through a combination of federal, state, and program revenue funds. So it's a fairly large and significant portion of the state budget, and contributes one of some of the biggest impacts and sectors of our economy and the budget process. In terms of what's included in the budget, next slide, please. And I'm just going to touch on these very briefly here, and then my esteemed colleagues are going to go into more details here. But we are, putting Medicaid expansion is in Governor Evers' budget. Again, that's $1.6 billion, covering 90,000 lives across the state of Wisconsin that could be used. So again, a lot of those investments are key, not just for Medicaid itself, but for all of the other things that allows us to fund and to provide. We'll also be focusing on building healthy communities, improving mental health access and crisis services in our state, being sure to invest in our long-term care programs, as well as addressing staffing and workforce need across all of our healthcare sectors. So again, all of my colleagues are going to be getting this a little bit more detail, but these are the big key items that we want to hit and want to mention here in Governor Evers' budget. So with that, I'm going to turn it over to Jamie Kuhn, our state Medicaid director, to talk about how we're going to expand Medicaid in the state. Jamie, take it away.
Thanks, HJ. And I too am really appreciative of everyone being here today. I'm going to talk a little bit about Medicaid expansion, and again, want to send out thank yous and appreciation for those of you who have already been working in this space. As you know, the budget proposal for DHS is once again anchored by Medicaid expansion, which would expand high quality, low cost Medicaid coverage to Wisconsinites with income up to 138% of the federal poverty level. Expanding this access to quality healthcare services ensures that everyone has the ability to receive preventative health services and can adequately treat illnesses or emergencies. Expanding Medicaid access to eligible tribal members will help extend tribal health benefits, as the federal government reimburses at 100% for services provided to eligible tribal members. And as of March 2023, Wisconsin is one of only 10 states that have chosen to not expand Medicaid at this point. The states that have expanded Medicaid have experienced positive outcomes as more people gain access to needed treatment and care, hospital stays open, and jobs in the economy grow. This budget proposal is also good for Wisconsin's workforce by increasing the number of people who can find and maintain full-time employment and helps prevent medical bankruptcies. The significant savings from Medicaid expansion allows the governor's budget to expand the benefits available to members through the Medicaid program to better meet their needs. Medicaid expansion savings can be used for improving public health, strengthening our behavioral health, investing in long-term care, and making health insurance and prescription drugs more affordable. Expanding Medicaid is good for health and good for our workforce. Other investments within Medicaid through Medicaid expansion. One is coverage for doula services. Doulas provide physical, emotional, and educational support to mothers before, during, and following childbirth to help achieve better maternal and infant health outcomes. And the governor's budget recommends providing funding to expand Medicaid benefits to include doula services. Community health workers serve as a liaison between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. The governor's budget recommends providing funding to expand Medicaid benefits to include services provided by community health workers. Community health benefits are non-medical services such as housing referrals, nutritional mentoring, stress management, and other services positively impacting a person's economic and social condition. And Governor Evers' budget provides $25.5 million over the biennium to fund a medical community health benefit that would provide these non-medical services to Medicaid recipients. Services would be delivered by various culturally competent organizations and would be adapted to the needs of members in each community. We are also funding community dental health coordinators through grant program. Currently, Wisconsin ranks 41st nationwide in children's dental access. Only 37% of Wisconsin dentists were Medicaid providers, and only 47% of those were considered active. Wisconsin's Medicaid members' primary barrier to receiving dental care is difficulty in finding a dentist. So to increase access to dental service for Medicaid members, Governor Evers has proposed $1.8 million for a grant to support dental health coordinators across the state. And this proposal is also supported by the Governor's Health Equity Council. Dental therapist licensure. The governor recommends creating a new license for dental therapists to increase the number of dental providers and dental services provided across the state, especially in regions designated as dental provider shortage areas. This is in addition to investments in the Department of Safety and Professional Services. Coverage for acupuncture services. The governor recommends authorizing coverage of acupuncture services for Medicaid recipients. These services would be modeled after Minnesota, which would include services for a variety of underlying conditions, including acute and chronic pain, depression and anxiety, and post-operative and cancer care. Total funding would be $3.2 million in the governor's budget. We would also like to cover continuous glucose monitoring and insulin pumps to offer more equitable access to continuous glucose monitoring devices and insulin pumps. The budget expands access by offering these devices through the pharmacy benefit. DHS would expect to see an increase in continuous glucose monitoring and insulin pump claims as it plans to offer coverage for individuals with both type 1 and type 2 diabetes. Total funding would be $23.2 million. And other Medicaid rate increases, the governor is recommending a 10% increase above calendar year 2023 rates for autism treatment services provided under the program, increasing expenditure authority to provide a rate increase for emergency physician services, and increase the Medicaid rate reimbursement rate for outpatient mental health and substance abuse services and child adolescent day treatment to increase access to treatment and suicide prevention services. The budget also provides 133,600 all funds in fiscal year 2024, 174,600 all funds in fiscal year 2025, and 2 FTE positions to create a Medicaid tribal reimbursement support team. We continue to build on our understanding of how Medicaid intersects with the tribal health systems, and this budget proposal will help support these ongoing efforts. Thank you, and now I'd like to turn things over to Paula Tran to talk about the budget initiatives aimed at building healthier communities.
Thank you so much, Jamie, and want to echo the sentiments of my colleagues, thanking you all for your ongoing partnership as we continue to dig into important health and public health initiatives across the state. So public health activities lay the groundwork for healthy communities, and they protect us from diseases and injury we cannot prevent alone and help us change behaviors harmful to our health. Compared to the rest of the nation, Wisconsin has been significantly underfunding its public health efforts for years. Recognizing this fact and the importance of a strong public health system to protect and promote the health of all Wisconsinites, the governor's budget makes Wisconsin's largest GPR public health investment to date. Next slide, please. The budget asks for improved funding for improved birth outcomes by allowing DHS to invest in grants for maternal and infant mortality prevention, expand fetal and infant mortality review teams, fund a grief and bereavement resource for families who have lost a fetus or infant, and positions to support maternal mortality review. The budget also proposes to extend postpartum coverage from 60 days to 12 months. We aim to build on the American Rescue Plan Act of 2021, change federal Medicaid law, allowing states the option to further this continuous coverage. Extending the postpartum coverage would improve continuity of care and reduce disparities in postpartum follow-up care for chronic conditions associated with mortality rates. Next slide, please. Also, the budget awards additional emergency medical services for flex grants. We know that EMS providers have been affected by the COVID-19 pandemic by greater demand for EMS services all across our state. Increased costs associated with providing those services and limitations on public health funding for those services created by the economic consequences of the pandemic. This budget invests $150 million to continue the EMS Flex Grant program, which provides public and private emergency service providers with funding for reasonable operating expenses, including but not limited to supplies, equipment, training, ambulances, and emergency response vehicles and staffing. The budget also updates and reforms emergency medical responder certification. Governor Evers' budget reforms how emergency medical responders are licensed by certifying individuals as emergency medical responders if they complete a certified training program or pass a National Registry of Emergency Medical Technicians examination for emergency medical responders. This budget also removes the barriers for first responders with post-traumatic stress disorder when seeking workers' compensation. Next slide, please. There are also important investments to our environmental health infrastructure. Per and polyfluoroalkyl substances, or PFAS, are a group of human-made chemicals used for decades in numerous products that are known to be toxic, mobile, and do not break down naturally. A number of PFAS compounds are known to pose a risk to human health, causing adverse health effects. To prevent harmful health effects caused by PFAS, the budget proposes funding to conduct education and outreach specific to PFAS to ensure Wisconsinites are aware of dangers. This is an additional investment alongside of the investments made within the Department of Natural Resources. In addition to environmental health, we know that there are a wide range of chronic diseases that require investment as well. Tobacco is Wisconsin's leading cause of preventable death and costs the state more than $4.6 billion annually in healthcare and lost productivity expenses. In 2019, 20.6% of high schoolers in Wisconsin regularly use vapor products, and 45.5% had tried a vapor product. To address the significant health harms caused by tobacco and vapor product use, this budget increases the minimum age to purchase tobacco and vapor products from 18 to 21, bringing Wisconsin in alignment with federal law. In addition, the budget prohibits the use of vapor product in indoor locations and on public, private, or charter school property. The budget also provides just over $1 million in GPR over the biennium to support the American Indian Quit Line. In addition to tobacco use, childhood lead poisoning prevention is also a key focus in this budget. In 1978, lead was banned from being added to paint and varnish for residential use because researchers found it to be toxic to humans and animals. It can damage the brain and other systems, leading to developmental delays, learning disabilities, reduced IQ and attention span, and a range of other health behavioral effects. While lead can hurt anyone, children under the age of 6 are most susceptible to the effects of lead poisoning. In 2020, over 2,100 children under the age of 6 had a blood lead level that exceeds the CDC's recommended levels. The budget builds upon foundations laid by previous budgets and makes key statutory changes and critical investments to continue to lower the incidence of lead poisoning in Wisconsin. This includes expanding early intervention services provided through the Birth to 3 program to children with blood lead levels over the CDC levels. Next slide, please. The budget also proposes launching a new electrocardiogram screening pilot program for youth participating in athletics. The budget provides $4.17 million in GPR in fiscal year 24-25 for the pilot program in Milwaukee and Waukesha counties. This will allow local health departments to help prevent cardiac-related health incidents in student athletes and will be critical in identifying any best practices and strategies for consideration in developing a future potential statewide expansion of the screening program. In addition, there are investments to improve the availability of healthy foods. The Double Up Food Bucks pilot program is an opportunity for food share members to increase their overall buying power by matching federal dollars spent purchasing fruits and vegetables. Governor Evers' budget recommends instituting this pilot program to allow food share benefits to be stretched further. And finally, on this slide, nod to the continued investments to maintain the personal protective equipment warehouse stockpile. The warehouse remains a critical component of the COVID-19 pandemic response and other emerging infectious diseases response and recovery efforts. Having an ample supply of PPE is critical to reducing the risk of exposure to disease and ensuring the health and safety of healthcare responders throughout Wisconsin. This budget creates a 60-day stockpile for PPE. Next slide, please. There are also proposed critical investments to our aging and disabilities programs across the state. First, enhancing the adult protective services system. Wisconsin's population is aging and incidents of exploitation and abuse are unfortunately increasing. Wisconsin's APS system requires recommitment of funding for training, needs assessments for tribal adult protective services, guardian support and elder justice training grants, and other protective services enhancements. This budget also provides dollars to counties to help administer frontline adult protective services. Healthy aging through evidence-based prevention programs will be expanded under this budget. There are currently 1.06 million adults over 65 years old in Wisconsin. By 2040, that number is expected to grow by almost 50%. Investing in interventions that promote older adults' health and support their ability to remain in their homes and communities is essential to help limit cost growth in long-term care programs and to promote quality of life for individuals as they age. Governor Evers' budgets invests in proven programs across Wisconsin to improve health, reduce cost, and prevent or delay disease among older adults. This budget also invests in translating DHS's website and forms into multiple languages. The budget provides funding for these translations throughout the state, including in Spanish, Hmong, Somali, and others. The budget also has dollars to serve all eligible children in the Medicaid Children's Long-Term Support Program. The budget proposal guarantees all these children with disabilities who have long-term care needs can access care in their communities and prevent children from being put on a wait list for critical services. And now I'll turn things over to Ginger Steele to talk about the budget initiatives aimed at improving mental health and crisis services.
Thanks, Paula. It's a privilege to be here. The past few years have been tough on all Wisconsinites, and Governor Evers' budget recognizes that behavioral health is essential to overall wellness. Governor Evers declared 2023 the year of mental health, and his budget built upon that declaration by making significant investments in expanding the availability of behavioral health services so that Wisconsinites can receive care closer to home. We must do all that we can now to ensure those who are in need of mental health support have access to care when they need it. We can't look back 2 years from now as we prepare the next budget and wonder whether we should have done more and sooner to take good care of our mental health. The budget supports a vast array of diverse and inclusive services to improve crisis response, invest in mental health access for people across their lifespan in their communities, fund suicide prevention efforts, and expand substance use disorder services. The budget also helps to ensure the right supports are available at the right time by expanding an integrated behavioral health system that provides prevention, intervention, and treatment services to all Wisconsinites. Next slide, please. According to the latest youth risk survey, behavior survey from the CDC, 42% of high school students experience persistent feelings of sadness and hopelessness. They also released data earlier this year that shows 57% of US teen girls felt persistently sad or hopeless in 2021. This is double the rate of boys and represents a nearly 60% increase and the highest level reported over the past decade. The report also confirms ongoing and extreme distress among teens who identify as LGBTQ+. As we know, it's not just our children who are in need of care. There are millions of adults in the US affected by mental health concerns each year. Based on 2020 data from the National Alliance on Mental Health, 1 in 5 adults in the US experiences mental health conditions each year. Next slide, please. Wisconsin's Youth Crisis System. This graphic shows available and proposed resources for youth experiencing mental health situations or substance use issues. The goal of Wisconsin's Youth Crisis System is to be able to provide the right care in the right place at the right time for all Wisconsinites. Someone to talk to. These services are available statewide. There's the Peer 1 Warm Line. Call, text, or chat with individuals with related life experiences for non-emergency support before situations such an emergency arise. Service is expected to be available in 2023 and is ARPA funded through September of 2025. The 988 Suicide and Crisis Lifeline. Call, text, or chat to connect with a counselor. This is funded through federal grants through September 2025. The Hope Line. Text with operators trained to provide emotional support. It's funded by state GPR and the Center for Suicide Awareness. County Crisis Lines. Call to talk to behavioral health professionals or trained volunteers during an emergency. This is funded by county budgets and Medicaid reimbursements. Someone to respond. These services are currently only available in certain areas of Wisconsin based on local support. County Mobile Crisis Response plus Enhanced Response Teams. At least one first responder or behavioral health professional responding in person to de-escalate and provide support. This is funded by county budgets and Medicaid reimbursements. Enhanced Response Teams, a group of up to 3 first responders and or behavioral health professionals responding in person during an emergency. Co-responder models. This provides mobile response using law enforcement and behavioral health professionals for individuals during an emergency. This is funded by municipal budgets. A safe place to be. These services are only available in select areas of Wisconsin. It's the intent to have all services available regionally with additional funding. Youth Crisis Stabilization Facilities. These are residential settings that provide counseling, therapy, and other services to youth ages 17 and under for up to 30 days. This is funded through state GPR and federal grants. Private and public hospitals. These are facility settings that provide intensive inpatient and treatment in the form of behavioral health professionals. This is funded through patient payments, private insurance, and Medicaid payments. The budget also includes 2 initiatives that would strengthen the youth crisis system and ensure youth in crisis have a safe place to be. Psychiatric residential treatment facilities. These are non-hospital settings for youth that would offer intense, focused treatment to promote a successful return home or to a less restrictive community setting. This funding is needed for this, and it's a part of a state budget proposal. Crisis urgent care and observation centers. These are facility settings similar to hospital emergency departments that would offer assessment and support from behavioral health professionals. Funding is needed, and this is also a state budget proposal. Next slide, please. Improve crisis response. In recent years, Wisconsin's crisis system has faced rising service volumes, with counties responding to 35,000 crisis calls statewide in 2021. This has increased burdens on county law enforcement, county services, law enforcement, hospitals, and other providers to respond to people who urgently need care. Governor Evers' budget includes $10.1 million to support the development of up to 2 crisis urgent care and observation centers that would serve as crisis service hubs and offer a range of behavioral health services to anyone from walk-in appointments to first responder emergency detention drop-off. We understand that some tribal communities experience gaps in access to crisis services, and we need to continue to work in partnership with tribes to address those gaps. Support youth crisis stabilization facilities. The state has recently developed the 3 crisis stabilization facilities specifically designed for the needs of youth experiencing a crisis. This budget provides $1 million in stable, ongoing support to ensure these facilities continue to serve youths closer to home, support the needs of the communities they are in, and reduce the need for more intensive treatments. Next slide, please. A psychiatric residential treatment facility, or PRTF, is defined under federal law as a standalone inpatient psychiatric setting for youth that is not a hospital. PRTF programs are intended to offer intense, focused mental health treatment to promote successful return home or to a less restrictive community setting as soon as clinically feasible. This initiative would allow DHS to create a new provider type serving youth with behavioral health treatment needs and includes $1.79 million to establish a 25-bed facility. It also allows Medicaid benefits to include a psychiatric residential treatment facility benefit. Next slide, please. Continue funding peer recovery centers and expansion. Peer recovery centers provide no-cost, person-centered advice, skills training, and a place to connect with others in the local community who have lived experience with behavioral health conditions. The budget provides $520,000 for ongoing funding to support the existing 8 peer recovery centers in the state and the establishment of 2 new centers to expand access to areas not currently served by the existing centers. Offer culturally and linguistically affirmative behavioral health services to those who are deaf, hard of hearing, or deafblind. Governor Evers' budget includes $1.94 million to develop a statewide behavioral health treatment program directly tailored for those who are deaf, hard of hearing, or deafblind, where people will receive treatment directly from a behavioral health provider. Improve accessibility and affordability of receiving critical mental and behavioral health care. Mental health treatment can be hard to find in rural areas of the state. Governor Evers' budget proposes funding to provide vouchers for mental health services that can be used either in person or via telehealth appointment for farmers in rural areas. Affordability is often also a barrier to receiving care. In emergency situations, people often do not have the ability to choose what type of care they receive or where they receive it. This budget would increase cost transparency and protect people against unreasonably high medical bills for behavioral health services received during a crisis. Next slide, please. Invest in mental health services in schools. To address the high and increasing prevalence of mental, behavioral, and developmental health concerns in children, this budget makes historic investments in improving and expanding services in school settings. This budget would increase the amount of federal Medicaid reimbursement returned to schools through the School-Based Services, or SBS program, increasing funding to schools by $112.4 million over the biennium. Additionally, it provides nearly $11 million to improve access to telehealth in schools. This would allow school districts to bill Medicaid for reimbursement as telehealth originating sites. Expand access to psychosocial rehabilitation services. Psychosocial rehabilitation service, or PRS, are a category of services to help people with mental illness or substance use disorder manage their day-to-day lives. The services are often complementary to psychiatric care, drug therapies, and other treatment people may receive for their condition. PRS treatments and resources may vary from case to case, but can include medication management, psychological support, family counseling, location and independent living training, housing, job coaching, educational aid, and social support. Governor Evers recommends providing funding to expand Medicaid benefits to include a psychosocial rehabilitation benefit, and also recommends DHS provide reimbursement under the benefit to non-county partners. This may be an opportunity for tribal providers to seek reimbursement. Utilize marijuana excise tax to support behavioral health services. Under Governor Evers' budget, DHS would distribute excise tax revenue generated from the legalization of recreational and medicinal marijuana to counties to support their behavioral health services, alleviating revenue pressures that counties have been experiencing in recent years. Qualified Treatment Trainee Grant Program. The Qualified Treatment Trainee Grant Program facilitates the licensure and certification of those in the process of obtaining or already with a graduate degree in psychology, counseling, marriage and family therapy, social work, nursing, or a closely related field to help address the shortage in the behavioral health workforce. Next slide, please. Expanding staffing and resources for Wisconsin's 988 Suicide and Crisis Lifeline services. Lifeline services, answering calls, texts, and chats from residents throughout the state went into effect in July 2022. The counselors at Wisconsin Lifeline are trained to listen and support people through their distress with a focus on de-escalation and coping skills. The budget provides $3 million of state funds to maintain the call centers and support the increase in call volume the Lifeline has experienced since its launch. Establish a suicide prevention program. The budget includes $1 million for DHS to create a suicide prevention program to coordinate suicide prevention efforts across the state. The program will also develop and provide educational materials and public awareness campaigns on suicide prevention. The program will further provide grants specific to the prevention of suicide by firearm use and support staff trainings at firearm retailers and ranges on how to recognize those at risk. Next slide, please. 8% of Wisconsinites, approximately 450,000 people, have a substance use disorder. In the last decade, Wisconsin has seen opioid drug overdose deaths triple. Deaths involving the use of stimulants have also been on a continued rise in the state. Substance use and its adverse effects continue to impact our communities on a deeply personal level. Develop integrated behavioral health stabilization, intoxication monitoring, and detox facilities. The budget supports the development of these behavioral health facilities by expanding Medicaid reimbursement to include these new facilities. These facilities provide patients information on harm reduction strategies, connect them with community resources, and aid in transferring them to the level of care they need upon stabilization. Medicaid coverage would become effective July of 2025. Support addiction prevention and treatment response. Governor Evers' budget recommends providing nearly $3.3 million in funding to support stimulant treatment services in counties in high need to meet the increased demand for treatment service availability. We would expect some tribal nations to fall within these counties. Ensure accessibility of needed residential substance use services. Affordability can often be a barrier to getting treatment for Wisconsinites who are struggling with substance use disorder. Medicaid implemented reimbursement for residential treatment and recently expanded coverage to institutional settings. This reimbursement covers only the cost of treatment and not the cost of room and board at residential facilities. This budget provides $16.6 million in funding to expand Medicaid benefits to include coverage of room and board costs for the residential substance use disorder treatment. I'll turn things back over to Jamie to talk about investments in long-term care.
Jamie, are you still
Sorry, I
here?
apologize.
Okay.
The long-term care industry has been impacted by the COVID pandemic as well and is facing numerous challenges from staffing to financial stability. Sustainability. This budget makes investment to bolster, stabilize, and support long-term care providers across the state. Continuing home and community-based services help older adults or those who have disabilities live independently in their community by providing help with tasks like getting in and out of bed, personal hygiene, preparing meals, and getting dressed. And in 2021, ARPA gave states a temporary 10% increase to the federal matching percentage for certain long-term care Medicaid expenditures for home and community-based services, and required states to reinvest those funds in our HCBS system. This budget provides state funds to continue those key investments, including to provide a 5% rate increase and develop a minimum fee schedule for home and community-based services. Increased aging and disability resource centers funding also is important to keep up with increased demand. Wisconsin's 47 ADRCs, or Aging and Disability Resource Centers, and 7 tribal aging and disability resource specialists streamline and support access to services for older adults and those with disabilities, regardless of income. With services designed to support people to live their healthiest and most independent lives, resource centers can address the high rates of health disparities experienced by older adults who are disabled by tailoring programs to meet the specific needs of the community. This budget proposal recommends funding to ensure this service is available to all older adults and those with disabilities and expand caregiving support services to every county. The budget includes $5.5 million in GPR in fiscal year 2025 to provide grants to the 11 federally recognized tribal nations in Wisconsin and to make improvements in Native community facilities and Native citizen housing, and $1.7 million in GPR in fiscal year 2025 to support the ongoing costs of the tribal aging and disability resource specialists to continue to serve as liaisons between the tribes and aging and disability resource centers. The governor's budget also invests $15 million in GPR into a complex patient pilot, which aims to address difficulties and delays experienced in placing individuals with medical challenges in post-acute care settings. The ongoing staffing issues faced by long-term care providers have led to costly delays in discharge from hospital settings, and this pilot seeks to find innovative approaches to more timely placements. With the state's population aging rapidly, investments like this are more critical than ever to ensure Wisconsinites are cared for in the most appropriate setting for their needs. Long-term care workers provide care to Wisconsin's most vulnerable residents, and Governor Evers' budget proposal recommends providing funds to increase rates paid to personal care workers and to support the direct caregiver workforce in family care. The governor recommends providing $88.8 million all funds over the biennium to increase the rates paid to personal care workers, an additional $88.8 million all funds over the biennium to increase the direct care and services portion of the capitation rates to support the direct caregiver workforce in family care. In addition, the governor's budget increases the income eligibility threshold from $48,000 annually to $68,000 annually, in addition to increasing expenditure authority for the existing Alzheimer's disease grant, as well as increasing funding for the program by $1 million. The governor also recommends providing increased funding to aging and disability resource centers to increase base allocations, as well as investing $13.6 million GPR funds into adult protective services, which protects elderly and vulnerable adults who are at risk of abuse and exploitation. Governor Evers' budget makes significant investments to address workforce shortages experienced by every sector of Wisconsin economy. And this budget builds upon investments made during the COVID pandemic using federal ARPA dollars to support talent development and policy changes to get and keep skilled workers in the Wisconsin economy. Wisconsin's healthcare workforce challenges were exacerbated by the pandemic, and the budget invests in long-term solutions to promote staffing across all healthcare sectors. These investments include continuing support of the WISC Caregivers Career Program, which aims to address the shortage of certified nursing assistants in the state by supporting recruitment, training, and retention of qualified caregivers for nursing home residents across Wisconsin. The governor's budget also recommends $22.5 million over the biennium to establish an ongoing innovative grant program for healthcare employers to engage and improve recruitment and retention of long-term care providers through the Healthcare Provider Innovation Grants. In addition, Governor Evers recommends providing funding to support a pilot project in Dane County focused on addressing the mental health crisis among healthcare workers and recruiting and retaining a sustainable workforce through the Healthcare and Public Health Innovation Grants. Healthcare long-term care providers' quality assurance is addressed by workload demands for quality oversight for long-term care services. And DHS manages and supports 7 care and treatment facilities for people living with psychiatric disorders and intellectual disabilities. And the budget invests in staffing for these direct care facilities by expanding capacity and fully staffing Mendota Juvenile Treatment Center, transferring security personnel at Wisconsin Resource Center to DHS. Security staffing at Wisconsin Resource Center are currently administered by both DOC and DHS, which introduces needless complexity and challenges to human resource administration in both organizations. We will also expand the intensive treatment program at Northern Wisconsin Center, which serves people with intellectual disabilities and currently has the capacity to expand its program. And with that, I will hand things back to Gail.
Thank you, everyone. Those that participated from the tribal communities and our administrators here within DHS. There will be additional information on our DHS website. As we noted at the beginning, we've been recording today's webinar, and we'll provide a link to the recording and slides from today to those of you who registered. With that, I will open the floor to you to share any questions you might have, or you can type that in the Q&A box if you have any. And just as a note, Jane included the link to where you can post public comments to the budget as well. It's in the chat box. I'm not seeing any questions come up at all. To learn more about the budget, you can go to, oh, here's the link here on this slide. And we will, as we go through more of these budget briefings, we'll continue to build our budget website with additional resources throughout this process. Again, I want to thank Deputy Secretary Deb Standridge, H.J. Waka, Jamie Kuhn, Paula Tran, and Ginger Steele for walking us through DHS's budget initiatives today. And I want to thank you all again for taking the time to be here and for all that you do to protect and promote the safety and health of your tribal communities. We appreciate your time and your work and your willingness to engage in this budget process. And I think with that, we have gotten through our briefing today. Thank you all. Appreciate your time.